Okay, so picture this. You've just had surgery, and you're so eager to get back on your feet.
Right.
You're doing all the exercises your PT's given you,
Yeah.
but something just feels off.
Yeah.
Your recovery is just not what you expected.
Interesting.
What if the missing piece isn't the exercises? What if it's what you're eating?
That's a really great question, and it's one that's being asked more and more these days.
I bet.
Today, we're diving into the link between nutrition and PT.
Love it.
You know, it's often overlooked,
Yeah.
and you sent over some really interesting research for this deep dive,
I did.
including some studies on PT's understanding of nutrition, and even, get this, a position statement from the Japanese Association of Rehabilitation Nutrition.
I know, right? It's fascinating stuff, and one thing that really stood out to me was this gap between everyone agreeing that nutrition matters and then
nobody's actually doing anything about it.
Exactly.
Yeah, it's like we all know it's important, but
then nothing's...
It's like having a mechanic who knows how to fix your engine, but doesn't know the difference between gas and diesel.
Oh, that's a good analogy.
You know, your body needs the right fuel to perform at its best.
I like that.
Let's get into specifics.
Yeah.
We've got the study of Israeli physical therapists, and it highlights some really concerning knowledge gaps.
Right. Like over 88% of them weren't up to date on food categorization guidelines.
Yeah, it's a big deal.
Huge red flag.
The interesting thing is most of these PTs, they understood, you know, the basic functions.
Like the basics.
Like what vitamins and minerals do.
Right.
But then when it came to identifying health risks like malnutrition or dyslipidemia, which is like, you know, an imbalance of fats in your blood.
Right.
There's a real disconnect.
There is.
And that's where having a solid nutrition education comes in.
So they know the exercises, but maybe not how to address the underlying nutritional issues that could be affecting their patient's recovery.
Exactly. It's like, you know, building a house on sand.
Yeah.
You need the right building blocks, and those are nutrition.
Absolutely. And this is probably why so many physical therapy programs just don't really focus on teaching nutrition.
Right. And it makes you wonder how many PTs out there feel like they're missing a vital piece.
Yeah, 100%.
When they're trying to help patients recover, fully recover.
For sure.
And that's why programs like the Nutritional Physical Therapy Program, that's gaining a lot of traction in Japan.
It is.
It's crucial, you know? They provide PTs with the knowledge and skills. They need to really offer holistic care.
So what are some specific examples of how nutrition is being integrated into practices now?
Well, the Japanese Association of Rehabilitation Nutrition has this position statement. That's a great example.
I was going to say, I read that. Yeah.
They're really leading the charge here, but really emphasizing this concept of nutritional physical therapy, which is basically, you know, they highlight the unique nutritional needs of patients based on their condition. So it's not like a one-size-fits-all.
So can you give me some examples of how these personalized plans might differ?
Absolutely. So, for instance, you have someone recovering from a stroke, especially if they're having trouble swallowing.
Right.
The focus might be on modified food textures and strategies to make sure they're getting enough to eat.
Makes sense. And how would that differ from, let's say, an athlete recovering from an injury?
Yeah, in that case, you know, you might focus more on protein to support muscle repair, and of course making sure they're getting enough calories.
Right, for their training and recovery and everything.
Exactly.
It sounds like the Japanese model is light years ahead.
They are.
It's amazing.
It's so exciting to see this happening.
Yeah.
This focus on nutrition within PT.
It's really cool. And what's amazing is just how many different conditions they address in this paper. Everything from sarcopenia, which is like muscle loss in older adults, to obesity, stroke, sports injuries. It's amazing.
It really is. And it highlights that nutrition is a key part of recovery for a huge range of challenges.
Yeah, it's not just for, you know, athletes or people with like specific dietary restrictions. It's recognizing that anyone going through physical therapy could benefit from some nutritional guidance.
Exactly. And the beauty is that it's not just about treating the injury or the ailment. It's about really promoting overall health and well-being.
It is.
Empowering people to kind of take control of their recovery and build a foundation for long-term health.
I'm curious, what kind of benefits are we seeing in patients who are actually getting this combined approach?
So the research is still, you know, kind of in its early stages, but early signs suggest that it can lead to faster healing, less pain, less inflammation, improved strength, and even a lower risk of future injuries.
It makes you wonder if it should just be a standard part.
I think so.
Of all physical therapy.
I know.
It makes sense, like if it helps people heal faster and better, why wouldn't we do it?
Exactly.
And for PTs looking to add this to their practice, that nutritional physical therapy program seems like a great place to start.
Absolutely. It's really designed for PTs who want to learn more about nutrition.
Cool.
And integrate it into how they treat patients.
Love it.
So we know nutrition's vital for recovery.
Totally.
But for PTs who didn't get much training in it in school, where do they start?
Yeah, it can feel overwhelming.
It can.
To add a whole new thing to your practice.
Yeah, but it doesn't have to be a huge change all at once.
True.
Even small things can make a difference.
So what kind of small things are we talking about?
Well, just starting by asking your patients about their eating habits.
Oh, during the intake assessment.
Exactly. Just a simple question.
Like, what'd you eat yesterday?
Yeah, or even just tell me about what you typically eat in a day.
That's so simple.
But you'd be surprised how much it can reveal.
Right. Like, what are some red flags PTs should be looking for?
Things like skipping meals.
Okay.
Or relying on processed foods. Big weight fluctuations.
Right.
Those are all signs that maybe they need a little more help.
And the PT doesn't have to be a registered dietitian?
No, not at all.
It's more about spotting those potential problems.
Exactly.
And knowing when to refer out.
Right, knowing when to say, hey, this is beyond my scope.
Exactly. But what about those everyday situations?
Yeah.
Where a PT can offer some basic guidance.
That's where you focus on empowering patients.
Okay.
With practical tips.
Like what?
Well, just emphasizing whole foods.
Okay.
Staying hydrated, getting enough protein.
Especially if they're recovering from something.
Right. Especially then.
It's about giving them the knowledge.
Yeah.
So they can make good choices.
Exactly. And PTs can use their expertise in movement and exercise to personalize plans even more.
Oh.
So let's say you have a patient who's trying to build muscle after an injury.
Yeah.
You can design a strength training program.
Okay.
And give them guidance on protein.
At the same time. So it's not just about the exercise.
Right, it's both.
It's about the food, too.
It's about recognizing that they work together.
And I bet collaborating with registered dietitians can take this to a whole new level.
Absolutely.
Okay, so give me an example.
Okay, so imagine a patient recovering from a stroke, working with a PT to regain mobility. The PT notices the patient's really fatigued and weak.
Yeah.
They consult with a dietitian who finds out there are some nutritional deficiencies.
Gotcha.
The dietitian creates a meal plan. Yeah.
The PT adjusts the exercise program.
It's like a tag team.
It is. It's a team effort.
And the patient wins.
And this isn't just for stroke patients.
Right.
It can be applied to all kinds of conditions.
But I bet some PTs are thinking, I'm already swamped.
I know.
How am I supposed to add nutrition counseling to my day?
Right. Time is definitely a factor.
It is.
But there are ways to be efficient.
So, like what?
Well, for example, you can use a quick nutrition screening tool during that initial assessment.
So you're identifying the patients who might need more help early on.
Right away.
I like that. And don't forget about patient education.
Yes, that's huge.
Like just having handouts or even like online resources with good information.
Evidence-based information.
Right. That can make a difference.
It can. And you can go beyond one-on-one counseling.
Oh,
you could do workshops, group sessions on things like healthy cooking.
I love that.
Or reading food labels.
Yeah, that's great. Build a community.
Yeah.
And of course, there's telehealth.
Which is amazing.
For virtual counseling.
It's a game changer.
It is, especially for people who can't travel easily.
Totally. And there are so many apps now.
There are.
That can help people track their food.
Yeah.
Monitor their progress.
It's like having a virtual coach.
I love that.
And for PTs who want to learn more, there's continuing ed courses.
So you missed out in school.
Yeah.
You can catch up.
You absolutely can.
Like with that nutritional physical therapy program.
Exactly.
It's a great resource.
It is. It bridges the gap.
And it makes PTs leaders in the field.
Leaders in nutritional physical therapy.
I love that.
And it's not just about patient outcomes.
Right.
It's about prevention, too.
So it's bigger than just helping people recover from injuries.
Right. It's helping them build lifelong health.
That whole new way of thinking about physical therapy.
It is. It's holistic.
I love it.
It's recognizing that food is medicine.
Oh, I like that.
And movement is medicine.
Food is medicine. Movement is medicine.
And when you put them together...
Powerful.
It's transformative.
If you're a PT listening...
Yeah.
And you want to make a difference, enroll in that program.
the Nutritional Physical Therapy program.
Or something similar.
Yes, invest in yourself.
And your patients.
And the future of physical therapy.
But there's another piece to this.
Oh, there is.
We need to talk about the ethics.
Yes, absolutely.
We'll get into that next time.
We will.
In the final part
of our deep dive.
So we've talked about all the amazing possibilities of combining nutrition and PT.
Yeah.
And all the practical steps PTs can take to actually integrate it. But now let's talk about something really important.
Okay.
The ethical considerations.
Yes.
A powerful tool.
It is.
But it's got to be used responsibly.
Exactly. You know, enthusiasm is great.
Yeah.
But we have to remember that PTs aren't dietitians.
Right.
There are limits. Yeah.
To what we can advise on ethically.
So how do PTs find that balance between being helpful and staying within their scope of practice?
It all starts with communication.
Okay.
Being upfront with your patients about your level of expertise.
Okay.
You could say something like, I can give you some general advice about healthy eating, but for more specific needs, you should talk to a registered dietitian.
That makes sense, being transparent.
Exactly.
Make sure the patient's getting the right care.
Yeah.
And you're not overstepping.
And it highlights how important it is to have a network of dietitians to refer to.
It's like having a whole team.
It is. It's a team effort.
Ready to support your patients.
That's a great way to put it.
Okay, but what if a patient asks about a specific diet?
Oh, yeah.
Or a supplement they heard about?
Again, communication is key.
Okay.
Acknowledge their interest.
Right.
But be clear that you're not qualified
to recommend those things.
Right. Steer them back to general healthy eating principles.
Right.
And stress the importance of seeing a dietitian.
It's about knowing your lane.
Exactly.
Staying in your lane.
Yes. And remember, respect patient autonomy.
That's huge.
They have the right to make their own choices.
Even if you don't agree.
Even if you wouldn't make those choices yourself.
It's about empowering them to make informed decisions.
Absolutely.
And that includes being sensitive to their culture and religion.
Of course, there's no one right way to eat.
Right.
It's about being respectful.
And of course, confidentiality is key.
Absolutely. Just like any health information.
Dietary habits.
Yes.
Preferences.
That's all confidential.
That's how you build trust.
It is. It's essential.
So, to wrap things up.
Yeah.
We've covered a lot of ground.
We have.
The science, the practical steps, the ethics.
It's all connected.
It is. And the big takeaway is...
What is it?
Nutrition isn't just some extra thing.
No.
It's fundamental to healing and recovery.
To well-being in general.
Yeah.
It's about looking at the whole person.
Absolutely. A holistic approach.
So if you're a PT listening...
Yeah.
This is your chance to become a champion.
A champion for nutritional physical therapy.
Take that program.
The Nutritional Physical Therapy program.
Or a similar one.
Yeah.
Learn more.
Grow your skills.
Make a difference.
That's what it's all about.
And to everyone listening, you have the power to fuel your body for health.
You do.
Make good choices.
Find good guidance.
Don't underestimate the power of nutrition.
It's amazing.
Thanks for joining us on this deep dive.
It's been a pleasure.
Into the world of nutrition and physical therapy.
We'll see you next time.
For another insightful exploration.